by these medical interventions that these patients were told to go through. So it's to cover medical bills, it's to help children whose mothers took sodium valproate and then were exposed to it. They then therefore need help with housing. They can't get a job because of their developmental conditions. So that is what the money is for. The Commissioner would argue that this interim payment, this initial payment, is only one step, but also there is further concerns that all the recommendations that are being made are recommendations. It's up to the government now to act, and there's fear that that might not happen.
OK, Anna Collinson, I know you will keep on top of that case. Thank you very much for joining us from the newsroom. We're going to stay with health issues and those new incentives to dentists in England to take on NHS patients. Under the government scheme, there'll be cash bonuses aimed at getting more dentists in underserved areas. The Health Secretary, Victoria Atkins, says the plan will bring immediate and long-term solutions. But the British Dental Association has warned that more fundamental change is needed. Well, to discuss the issues, I'm joined by Dr. Sami Butt, a dental surgeon in Haywards Heath, and Gavin Egan, who drives 50 miles to see an NHS dentist. Gavin was a member of the Conservative Party for several years, but no longer affiliated with any political party. Dr. Butt, I wonder if I could start with you. These plans include this £20,000 bonus to set up in areas with poor access to NHS dentists. Do you think that is enough, and will it work?
No, it's not going to work. This isn't something new. Dental corporates have tried this as well, this kind of golden handshake to get people to come work in areas where they can't get dentists, and it doesn't work. And over 3 years, it's not, it sounds like a lot of money, but when you actually figure it out, it's not a lot. It's like £20 a day to relocate. I don't think it's going to work.
So what would work?
The contract needs to be reformed. That is the fundamental message that dentists have been saying, which the government continues to ignore. The UDAs are rubbish, they're pointless, and they need to get rid of that system.
So what is a UDA? You say that?
So they call it, it's a unit of dental activity. It's a metric by which dentists carry out their treatment. And actually going back to that, you can encourage people to come to these rural areas, but they have to work on this contract, which is the problem. It's an unworkable contract. So yeah, units of dental activity for a checkup, you would remunerate with 1 UDA. Fillings, you can get 3 or 5, and crowns 12. And it's a banding system, but it's terribly thought out.
Gavin, thank you for joining us. Just to explain what you have to do to be able to see your dentist.
Well, we are registered with an NHS dentist in Hampshire, which is where we used to live. And we moved about 2 years ago to further west into Dorset. And at the time, we thought we would stay with our current dentist just in case it was difficult to find to register with a new practice. And in fact, we're glad we did, because it turned out to be impossible. There was not a single practice taking on NHS patients in the whole of Dorset at the time that we moved. And from local community groups online, from what I've seen recently, that still appears to be pretty much the case.
Yeah, we can show some pictures from Bristol, which have been in the news this week, where they have been people queuing from 6 o'clock in the morning for the last 3 days for a new surgery that has opened. Dr. Butt, is that happening across the country? We've seen these pictures from Bristol because they've made the headlines, but do you know of other cases like this when a new surgery opens?
Yeah, this is a national crisis, and this isn't new. This happened to me 10 years ago. We put an advert out when we were accepting NHS patients, and we had a queue down the road. So this isn't new, unfortunately, and the government's failed to act on it.
Gavin, what effect has it had on your oral health, the fact that you've had to travel so far to see your dentist?
Well, obviously, it's not particularly convenient. It's about an hour and 20-minute drive. There's also the petrol costs associated with that every time you do it before you even get to the practice. So it's far from convenient. We do it because, you know, the health of your teeth is very important. So we absolutely make the effort. But really, we don't have any choice but to do that. And otherwise, we'd be paying very large sums of money to go to private practices. And I think that's out of the reach of the vast majority of people.
Yeah, so what do you make of the government plan?
It's a joke, frankly. It's not going to do anything. It's just tinkering around the edges. It's a typical kind of policy thrown out in advance of a general election. It's not really going to achieve anything much. The system needs complete overhaul, and we need to get back to a situation where people can access regular treatment for their dental issues, and that's going to take an awful lot more money than the Conservatives are suggesting.
Yeah, Dr. Butt, we heard on Nikki Campbell's phone in on 5 Live this morning, people who are taking extreme measures on DIY dentistry, pulling their own teeth out. That just seems horrific.
It shouldn't be. We are supposed to be a world-class healthcare provider in this country. It's the West, and it's terrible. Patients should not be taking their own teeth out in this day and age. It should be done in a healthcare setting, so that all risks are mitigated and patients are looked after, and that's simply not happening. And I'd just be more concerned about, we hear about this new money that's coming in, and they mentioned that they have to pay to travel. Patient charges have been going up year on year, so I'm worried about patients having to pay more into the service whilst the government withdraws its funding.
Another of the things that the government are planning on doing is incentives to bring international dentists to work here in the United Kingdom. Do you think that is a way forward so that we can at least bring more dentists into the country?
If you can get a skilled workforce that can provide the care that is expected, great, not a problem with that. I just don't think the government's capable of doing it.
Gavin, do you see any optimism amongst your friends?
I don't really. Just a lot of very sad stories, and a kind of almost like it's amusement really as much as anything when people talk about finding an NHS dentist. People just laugh nowadays.
Okay, Gavin, I think the line is just frozen there to Gavin, but thank you very much. And to Dr. Butt, thank you very much for joining us here on BBC News. There is more on that dentist story on the BBC News website or app. We are now, though, going to turn our attention to the weather. And I'm talking about the website. Well, one of the most read stories right now is the fact that an amber snow and ice warning has been issued